What is IgM MGUS?
So when we talk about an MGUS, monoclonal gammopathy of uncertain significance, is that you have this protein, this antibody in your blood that is sitting there, and it's a monoclonal protein, meaning that there's an excess of it and it's identical. And so that's akin to when your myeloma is making the antibody. But when you have an MGUS, you have the antibody, but we don't find an excess of any myeloma cells or lymphoma cells or any kind of cancerous cells that are making it. The protein is there by itself. And so it's unclear what that means. And some patients will eventually develop myeloma or lymphoma, and some patients will never develop any of these diseases. IgM MGUS is just a subtype of MGUS. So there's a small group of patients that have an IgM instead of an IgG or an IgA. And an IgM MGUS usually is more likely to become this thing called Waldenström's macroglobulinemia, which is a subtype of an indolent lymphoma. So when you look at myeloma and lymphoma, they're sister diseases because they arise from the same cell. It just depends on what level of their differentiation. So all B lymphocytes eventually can mature into a plasma cell. So if your disease mutates at the level of the lymphocyte, you develop lymphoma. If your disease mutates at the level of the lymphocyte that's becoming a myeloma cell, we call that a lymphoplasmacytic lymphocyte, that becomes Waldenström's, and that's more likely to make IgM. If it mutates at the point where it becomes a plasma cell, it becomes multiple myeloma.